Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. All are having a wonderful evening tonight. I am your co-host, Jocelyn Turner, and I am so delighted to have a lively discussion tonight with a distinguished panel of guests. Joining me, of course, as co-host is Dr. Rogers Kane. Dr. Kane, how are you this evening?
I am fine, Ms. Turner. I am happy as you are to have two of my good friends and people that I respect so much professionally on our show tonight.
Isn't that the truth? I echo your sentiment and I was so excited when both of them agreed to join us on our show. Each week we try to enlighten our guests and really share what's on, but each week we try to bring relevant information about what's happening and what's current. What is it that we need to know? And as we say, as we pause for the truth, what is really going on that we need to talk about? Joining us this evening is one of my favorite people. He doesn't know it, but I actually tell people that he is one of my favorite people, and that is, I will refer to him as who he is tonight, and that is Dr. Oh, there she is. She's back. Dr. Jeff Goldhagen. Dr. Goldhagen, or Jeff, I know you'd prefer to be called. How are you this evening?
I am well, and thanks for the opportunity.
Absolutely. And of course, the famous Senator Audrey Gibson. Senator, how are you this evening?
I hope it's not just me
We're going to, we're going to go ahead and proceed with the show, and hopefully your technology will clear up tonight. Have a lively discussion. And I say lively because, a lot of things have changed throughout this whole pandemic. And quite frankly, people have asked, I've had numerous conversations with folks, and they ask, why do things keep changing? Why does Dr. Fauci and others get on and say, oh, things have, they're changing. So it's hard for people to navigate. One thing that we've tried to do in this show, Dr. Kane and I, is to bring guests on and have those sometimes tough conversations that some folk don't want to have, that Dr. Kane insists that we have, to make sure that that people know what's really going on. So tonight, as we wait for Senator Gibson to come back on, we will go ahead and begin the discussion on the topic: is the new COVID-19 legislation harmful to your workspace or workplace? Now, we know recently the governor of Florida enacted legislation that did not allow businesses to put some things in place to protect themselves from the virus. And that's my opinion of it. But it's not about me tonight, Senator Gibson. So I'm going to start with you and ask you, what is this legislation that the governor enacted to protect Floridians from losing their jobs due to COVID-19? Tell us about that.
Well, of course, we had a special session that I call trick and a charade parade. We didn't have to do. Really, the bill was all about, or the bills were all about pushing back against the president of the United States, something that never would have happened if Mr. And so there's the freedom they called it, and we had a rally in the courtyard with people dressed in period clothing on this issue, which is totally unnecessary. It's something that we could have certainly taken up during the regular session. It was the governor that he wanted to push the issue to call attention to himself more than anything else. So I will direct
my next set of questions, or my next question rather, to Dr. Goldhagen. So Dr. Goldhagen, as a result of the legislation, our school district, like many others in the state, had to lift their mask mandates because of this new legislation. Should parents be concerned about their children getting the virus now?
Well,
Thank
so
you.
clearly, as the senator mentioned, what unfolded in Tallahassee was 100% political. It was 100% partisan politics, and it was antithetical to everything we know about public health. And so, actually, at the beginning of in particular, when vaccines became available, the governor was actually very supportive of vaccines. And appeared in multiple places to support vaccination. That changed when he realized that, in fact, his base would be energized if he changed his perspectives and his rhetoric. And now he, at the expense of Floridians, and I would say very definitively at the cost of thousands and thousands of Floridians' lives, that he sacrificed on the altar of partisan politics. He is now, it's called the special session, which was the continuation of his work to actually decrease the number of people in our state who have been vaccinated and lift the mandates that local governments and local school systems had put in place as far as masking is concerned. Rogers has said this, and I've said this, and our colleagues have said this. This pandemic is not over. It comes in waves. The reason why we are at a low point at this point in time, whereas it's surging in other places, because we had our last surge over the summer. And if you look at the results of that, tens of thousands of Floridians died unnecessarily during that period of time. And everything that local communities could do to help protect themselves, like a mask mandate in the schools, now have been basically overturned by his partisan politics. For those of us in health and those of us in public health, I think it's the saddest point in our careers at this point.
Jeff, and I recall when he did go down to celebration, Florida, wherever that place is down there where all his cronies are at. I recall when he went down there and he brought all the vaccines to those guys, and basically Jacksonville, especially Jacksonville's Black community or minority community, were being denied access to the vaccine. And so, but he quickly gave it to his friends, his contributors. Maybe I should put that in reverse order. To his contributors, he quickly provided the vaccine for them, and more than likely his family as well. I can't say that with 100% assurity, but my gut feeling says they're vaccinated. And so, it really irks me that you would call a special session to put at risk my family life and my patients' lives. But we'll get more into that as we.
So one of the things that struck me is that this legislation says that it was done to protect all Floridians. Senator, is this new legislation really protecting all Floridians? Senator, can you hear me?
It can't possibly.
Yeah, go ahead.
I think the connection is that she's frozen. Yes, we can hear you.
Can you hear me?
We can't anymore. So we'll move on. And
let me add to it, Ms. Turner. No, it can't protect all Floridians because I'm a Floridian. It's not protecting me. It's not protecting my patients. People that appear to be pawns in this political game. So I will answer at least that part and say no. It's not protecting all Floridians.
Yeah, and I think about and both you, Dr. Kane and Dr. Goldhagen, you are both physicians, and I can only imagine how the ebbs and flows you've had. You get folks vaccinated, you put policies in place, and with hospitals then are able to suggest or recommend or mandate that people wear a mask or get vaccinated. And now here we go again. Dr. Kane, I'm going to direct this question to you. Are you feeling uneasy, or I can't use the word threatened, but how are you feeling about this new legislation and knowing that you can't put things in place that you might have when it comes to hiring, for instance, if you were having some folks or needed to bring some folks on board?
Well, as you're aware, Ms. Turner, I have a practice that is very geriatric. As I got older, my patients got older. And they are the ones that at high risk, very high risk. I also have a practice with a lot of minorities, mostly minorities in it, which also is a high risk group. So I'm not feeling that easy about the new legislation. Now, I've put things into place to help protect my patients and my staff, but I'm a smaller practice, and so I can only envision that if I was in a bigger practice, or in these days working up on some of these hospital systems as they are trying to navigate these treacherous waters of this new legislation, I can only envision what kind of problem that will mean for my patients. They are being put very much at risk, and with this new Omicron, it sounds very ominous, but with this new Omicron virus out there, and we're not being sure exactly where it's going to just to position itself in terms of how infectious it may be, how even how deadly it can be. It is very threatening to my population, my patient population, and my family. Jeff,
So
you
since
see patient clinically as well. What's your?
Well, so I don't think any of us have ever been in this situation before. What the governor has done is said that you have to put your patients at risk. We took an oath that said that we would always make decisions in the best interests of our patients and the community. And I think at this point in time, it's about peaceful defiance of this law. Now, using the hospitals as an example, and Rogers and I just circulated a letter, should have gone out this afternoon, but the hospitals all established vaccine mandates. And then the governor passed this law. St. Vincent's lifted its vaccine mandate for its staff. And so now's the time to really be very defiant. First of all, the physicians in St. Vincent should say, no, we're not coming to work unless you implement this mandate. Physicians who refer patients to St. Vincent's ought to be referring patients elsewhere now. Those patients that have traditionally gone to St. Vincent's ought to say no. And so the fact is that we are in a very treacherous time, and we need to make our voice heard. And if it requires defying this law, then it requires defying this law. Let the governor close down UF Health. Let him close down Baptist. Let him close down primary care doctors' offices. Let him do it. We cannot, at this point in time, make decisions that result in the deaths. I mean, the deaths of thousands and thousands and thousands of Floridians, and in particular, vulnerable communities like minority communities, like Black and Brown communities. And this governor is making decisions that are killing people, and we just have to say no. Life is too valuable, and we're not going to stand still while you make decisions that are based in partisan politics that use us as pawns. Over 60,000 people in Florida have died. Nearly 4 million have been infected. we don't know the long-term impact of even people who have asymptomatic disease. And in particular for children, they have been, their rights to health and well-being have been profoundly impacted by this governor. And it's time to say no.
And we never agreed to become, truth be told, Jeff, while we gave an oath, as you and I have discussed, while we gave an oath to our patients to put them first and to protect them as best we can, we never agreed to become martyrs. And I most certainly never agreed to my family to become martyrs for politicians, for politics. And a lot of my colleagues, as you and I have discussed, are looking at just going ahead and retiring from medicine. As much as they love medicine, they're looking at it and saying, "Look, I'm done." And if we don't, as a profession, stand up now and be counted, and make sure that people realize that physicians and other healthcare workers, we're not by ourselves. Right. Physicians, nurses, pharmacists, respiratory therapists. If we don't stand up and let science be the dictator of what we need to do in this situation, all is lost.
Yeah, and I guess that's the thing that I think about. Again, if the law is about freedom for Floridians, can doctors choose not to care for people who refuse to get vaccinated?
Yes.
Yes, they can. They cannot abandon their patients, which means they have to give their patients a period of time to find another doctor, for sure. But they can, and pediatricians have done this for years. Some pediatricians choose not to admit patients who are anti-vaccine for their children. And so if parents don't get the vaccines for their children, then they're dismissed from the practice. Again, not abandoned, but appropriately dismissed, giving the families time to identify another provider. So yes.
And one other thing, Ms. Turner, what I need to make sure I add, even though I said healthcare professionals, when it comes to, especially in the hospital institution, hospitalized institution, and institutions where you may get lab drawn and stuff of that nature, we cannot forget, I don't want to call them janitors, but the hospital services staff, because they're putting their lives at risk as well. And it's just a shame that I have to, me and all other healthcare providers and what we call these essential workers have to put their lives at risk trying to keep this virus from killing another million people, because it won't be long if we keep the way we're going that we will be at 1 million people are dead. We're at 800,000 already, pretty much, for all intents.
Yeah, for sure.
So if we don't take a stand, if we don't take a leadership position, who will? So
thank you. Senator Gibson, can we hear you now? I won't say can you hear me now? Can we hear you now? Want to bring you back into the conversation. I hate you're having technical difficulties.
I think she's look here, she's in Tallahassee. It might be
somebody shutting her down. We won't go there, Dr. Kane. Yeah. So we'll continue the discussion. Okay,
so I'm here. Can you hear me?
There you go. Yes,
ma'am.
We can hear you now. I know it's so frustrating, but technology is what it is.
And I'm in the building, I'm sure, is very secure with everything. So I just want to make a couple of points. I heard you guys as I was trying to make my phone work, my laptop work, and I don't know what's going on. But certainly, I don't think people are safe because of the legislation that passed. Some people are not interested in protecting themselves, let alone others, right? And so we already know that vaccines work. So why would we down and tell people, or would a governor who is sworn to certainly protect and be the governor of all people tell people, hey, you don't need a vaccine because I said so, not because the science tells us that and so, and here's the disingenuousness in this whole process. We had 4 bills, 2B, 4B, 6B, 8B. And guess when there's an expiration date, like a pack of bread, right? There's an expiration date on the bills, and they all expire in 2023. So all of the things that we sat for 3 days go away.
In 2023, it most certainly has a stench of politicalization.
Yeah, and looks like we lost her again. So we will continue on with the discussion. So I wanted to get back to one question, Jeff. And what can parents do to protect themselves and their children, considering that they are going to school with the unvaccinated?
Well, this is a really difficult situation for parents, extremely difficult situation, because if their children who are going to school and parents mask their children, they're still being exposed to other children who are unmasked. The masks work 2 ways, one of which is to stop the spread, which is the primary way, but also to a certain extent to protect the actual infection from the air. But their children are not being protected. There's no requirement that the parents know whether or not the teachers have been vaccinated. There's this misperception that organizations, businesses, schools can't require the identification of who's been vaccinated or not. The HIPAA requirements only relate to healthcare institutions. They don't relate to other institutions. So school systems can identify who's been vaccinated and who's not. And so parents do need to know that when they send their children to school where the classrooms are there's no mask mandate and there aren't other precautions being taken, then in fact they are placing their children at risk. And one of the things that we do innately is try to protect our children. And this governor is requiring families to give up that innateness. And so the other flip of the coin is that families are saying, Mothers for Liberty, that we have the right to not put masks on our children, which is beyond foolishness. And it really boils down to just political partisanship. I have a nurse that I work with, and she's fantastic. And they went home. She's from the Aurora area in South Carolina, and she and her husband went back for Thanksgiving. They could only have Thanksgiving with a few relatives because most of the relatives were not vaccinated. And she just lost a 40-year-old cousin from COVID. And when she asked her relatives why they weren't vaccinated, they said for political reasons. And that just was profoundly impactful to me, that we have people in our country now who are choosing to potentially die for political reasons. And that to me is the scariest perspective, because it shows you how deep the vitriol and the hatred is in parts of our population as it relates to their vitriol of Biden, their hatred of progressives, their hatred of science, and that translates into their providers, their medical providers, which reflects on the question you asked earlier. I don't think that there's a need for physicians to choose to care for patients who are putting themselves at risk, putting their patients other patients to risk, and putting themselves at risk. And there are lots of healthcare providers that have died, martyrs, as Rogers has just said. And there's nobody that says we have to be martyrs for political purpose.
There was a question that was asked a few minutes ago. We talk about, can doctors choose not to see patients? How do patients know what providers who've chosen not to get vaccinated?
Don't ask.
Yep. You ask. That's what
Just
you do.
ask the question.
But Ms. Turner, the one thing I wanted to say, and that is the right. Those guys are saying that it's their right not to be vaccinated or not to have to be vaccinated. That's what you choose. Even though I think that's most borderlining with a lot of them on a cult, some cultivism or something like that. Without name calling, but you have that right. But the right of one or the individual does not supplant the safety of society as a whole. And people need to recognize. I mean, what do we do if we're going to do this for COVID? What are we going to do for measles, mumps, and rubella? Are we still going to force them to do the vaccinations before they go off to school or go into the school? I mean, how does that work?
Well, I even thought about it. I don't know if the senator can hear me and I think one of you already said it, the very politicians who have put some laws into place were vaccinated months ago. And so knowing, and for people to know that, but still believe I call rhetoric and saying, no. There's a question that was posted. Did the governor provide any liability protection for the doctors who may have a patient to get exposed to an unvaccinated patient who is wait a minute now. Did the governor provide any liability protection for the doctor who has been exposed, I guess, by an unvaccinated patient?
And I'm going to reword that question for you, JT. What they're basically asking is, if I have an employee or me myself decide we're not going to get vaccinated, what is my liability in that situation? I've got vaccinated, but if I knowingly allow an employee to handle, 5, 6, 10, 30 of my patients, whom maybe 5 of them come down with infection, what is my level of protection, or at least the liability that I have for allowing those patients to get infected?
Okay, so what's the answer?
Well, the answer is no.
Right.
But I don't know that actually the governor hasn't provided liability. No. But I don't know if it's whether that's been brought to the courts, and whether or not any facility has been sued for physician's practice or other facility. I can't imagine that there aren't suits against some of the nursing homes. But that's reason enough for a facility or a physician to say, and then we also, Rogers and I have spoken about if a physician does not want to dismiss patients from their practice, then just require all patients who are unvaccinated to be seen virtually. We'll see you virtually, but you can't come into the practice. And that's an alternative. That's a compromise alternative. Compromise.
Yeah, my patients takes precedence. My patient's protection takes precedence over convenience, so to speak. So I would more than readily see them. During this first wave when we had the Delta virus, I went out in the parking lot and saw patients because I did not want to put my staff at risk and other patients at risk. So we literally had my waiting room closed for a long time because I wanted to protect those patients who were most vulnerable.
Well, there's an elephant in the room here, and that's the Black community that, is succumbing to some of not the whole community for sure, but there is a substantial number who have succumbed to this misinformation and disinformation, and there's an irony there, right? There's an irony. So they've chosen not to listen to their doctors and other professionals, and as opposed to listening to the internet and the misinformation and disinformation. So there's a lot of work to be done, in the African American community, the minority community as well. The irony is, I'm going to put it in racial terms. They're letting white people kill them, and it just hurts. It just makes no sense. As they're coming to the racism, that the racist, and I think very much the racist policies of partisan Republican politicians.
Politics. Yep.
Yeah, unfortunately, at the expense of others. There are a lot of people who have underlying health conditions. And I still go back to, and I hate that we lost a senator
sure.
on the panel tonight, but I still go back to that this law is about freedom. That's all all that I've read is about freedom, the giving Floridians the freedom to choose. So I'm going to have to go there, and I hate to go there to just the two of you. So,
let me,
wait a minute. I got to ask this question. So I remember that, and tell me if I'm wrong, that if a person who is infected with HIV or has AIDS, and they knowingly infect somebody else, they could go to jail, right? Is that right?
Yes.
So, and that's because, in my mind, it could potentially be a deadly virus, right? So is there a similar law about COVID? So there are people who've chosen not to get vaccinated, and they knowingly have the virus and still go around other people. Can the people they infect sue them, or can they go to jail for knowingly spreading a deadly virus?
I'm not an attorney, and I can't even play one on TV. But what I can say, I understand your logic, makes a lot of sense to me. But the problem just winds up, as you've seen on Law and Order, you have to sit back and prove that they knowingly went to infect other people. And when you start talking about people's protecting, patient protection, or whatever protection they call it, whatever that lingo or language they talk about protection. What about my right to being protected? Am I supposed to give up my right and my patient's right to being protected from this virus because one person doesn't want to get vaccinated and want to make a statement in my practice to say I have the freedom to come to your office and unvaccinated and put all your staff and patients at risk? No, that's asinine. It's insane.
Well, I see Jamila, who I haven't spoken to in years. Jamila, hi. This has nothing to do with freedom. This is all about the 2024 election. This is about DeSantis getting elected. And that's what this is about. Nothing more, nothing less. It's about his election. And I hope ex-President Trump is watching this because he's your competition, and hopefully
he step up,
do whatever he needs to do to eliminate the future. The future of
Jeff,
this government.
As you know, I've had this conversation with you before, and that is, there's two ways that, since we're talking about racism, let's just be frank, we're talking about racism in terms of this discussion. There's two ways that if African Americans feel like they're being targeted for death by this virus, there's two ways to kill you by this virus. You can pretty much try and find some genomic mechanism by which only African Americans have been affected, but the races have been so mixed, and the cultures, the genomics have been so mixed. I find that very difficult to accomplish. But in case it was or is, there's two ways to do that. Yeah, okay, fine. But everybody's drinking from the same glass, so to speak, getting a vaccination from the same 25-dose vial or 15-dose vial. The other way is to convince you not to take the vaccine and let the virus kill you. Period. The end of story. If the virus kills you, nobody has to appear to look like they're intentionally being racist or intentionally trying to kill off a certain group, a certain race of people. So, look like I lost all of my supports.
Oh man, it's just us.
Well, they'll be back. I know Jeff will be back, and I think I'm not sure if Audrey is just being beat up
there
by
she
the
is,
governor's office.
sideways.
It's like a nightmare. Isn't
Yeah, and I felt so bad for you because I know you were trying so hard to get on, but
you're here now. Give it.
Yeah.
Let it
Can you
go.
hear me now? Can you hear me?
yes, we can hear you.
Well, I'm so upset.
Oh, and Jeff is back. Yes, we can hear you and see you very clearly. Thank you. You look like you're walking, but we can hear you. So, Senator, is there anything that you wanted to chime in on or add before, while you have the floor? I know you probably had a lot you want to talk about.
Yeah, because obviously, and we have a new variant, and I wanted to make sure that you all knew also that the OSHA standards were a part of the package that we did. So now all of a sudden we want to decide that, we don't need OSHA. We can do our own thing. And that's this is how deep the charade is. So OSHA is a federal agency, right? And under OSHA, there's the work standards, but that's also part of the whole mandating the vaccine. So every component of trying to get rid of vaccinations and keeping people safe was packed into 4 bills. So now we're going to try to create our own state entity, which actually it has to be more restrictive than OSHA. Oh, and by the way, we're going to put $1 million sucked out of our budget into a fund so we can figure out if we really want to get from under OSHA. That's $1 million. This expires in 2023 as well. And the other travesty is $5 million taken out of our general revenue. That's a total of $6 million for these 2 little bills. Well, 4. That is $1 billion is going into a pot general revenue, and remember, general revenue is what runs our state. And I told them in committee, so we're going to suck out $6 million, and remember, we're getting ready to go through session and those are funds that can be used in our communities when we fill out those budget request forms for the projects that we want in our communities, to include healthcare and other projects. It's going to sit in the Attorney General's office in the event that the Attorney General has to bring some lawsuit against the businesses. Okay, so this is like a 4 weeks.
Oh, wow. And you know what, Senator, I want to mention something. I want to mention something only because someone asked me, when the monies were allocated to give the first responders an increase for the stellar job that they've done throughout the pandemic, I know some health department folks, Department of Health people who also worked throughout the pandemic. And how come they are not considered to be first responders and also receive that? That's why everything seems to always be so about who I can probably get votes from rather than really the concern for or acknowledging the work that certain populations of people have been doing throughout this pandemic. So I just thought I'd toss that in there. Has nothing to do with the conversation, I know, but just really want to focus on how everything seems to be political. But I really want us to really focus on tonight, because it's all about how this legislation will affect individuals when they go to work tomorrow. So what can people see that maybe they've not seen yet? What can people see different now that those things that may have been put in place are no longer there because of this new legislation? Should people be concerned when they go to the hospital for the elective surgery or go to their doctor's office for routine care? Or just go to work in general?
Yes.
They should be concerned if they're not going to get it back and they're
But
not
I
going to
mean,
wear a mask.
for persons who are vaccinated, and then I even think, Senator, about those people who are going to work every day and their employer doesn't allow them to wear masks to protect themselves. And those are those frontline workers. You know, I go to restaurants, for example, and I see the workers don't. A lot of restaurants, they're not wearing masks, and so those are the folks that I'm looking at. Like, are they not wearing masks because they don't want to, or are they not wearing masks because their employer says they cannot wear masks? So how does the law protect those individuals?
It doesn't, because it's only if you're required to get vaccinated. And so if there's nothing in the bill that says if your employer doesn't allow you to wear a mask at work, that you have any recourse at all. That is not protection for every Floridian.
So when people talk about people not wanting to go back to work, it's not always just about people being lazy. People are choosing not to go back because they also have families. They have children. You know, the healthcare providers who are going, I saw a doctor on television and say one day that, you know, she respects the rights of people who choose not to get vaccinated. So she said, respect me and don't show up at the hospital with your unvaccinated sick self, because then you're now putting me and my family at risk.
Right.
And
The other thing.
Before we go, I want to make sure. Before we go, excuse me, I just don't want us to lose this point too about this bill, and so if I can stay on and my computer doesn't mess up. So the other part of this bill is the exemption clauses that you have to let your employer know that you have a health condition. So you get a note from the doctor. You have to an exemption for if you're pregnant, or here's the other kicker: trying to get pregnant. I said, or anticipate being pregnant, and I'm like, well, what are you using? What's trying to get pregnant or anticipate? What does that mean exactly? And then you have to get a note from your doctor to tell your business that you're trying to get pregnant so you can get the exemption from the vaccine. That is just absurd. How about just get a note to say you have a health condition? Why does it have to be specific about what the condition is?
And the other part of that bill winds up being, if they got a complaint, two other parts. They got a complaint, they have a right to that they can remain anonymous, okay? And in a small practice like mine, anybody under 99 employees, or 99 or less employees, for each violation that they say that you've had, you have to pay $10,000 per event. That makes absolutely that would put me out of business real quick.
So Jeff, are you concerned that this new legislation will have an impact on the rates of infection increases, especially now that there's a new variant?
Yeah, absolutely. If the primary care practices and the hospitals obey this law, right, then it will greatly expand the exposure of people to to COVID. And if this new variant turns out to be serious, it's already probably going to be very transmissible. Then we're in a critical situation. Let me just say, because we've talked about this before, this is just a dress rehearsal for, and we've said this is just a dress rehearsal for the next variant. Well, we see the next variant.
Mhm.
This is and this is going to continue. And what has happened is that essentially the governor and the previous governor has completely dismantled public health. So we have no public health system in the state. Literally, people may think that's an exaggeration. We have no public health system in the state. And in a community like Duval County, in particular, that has been completely dismantled. And so whether it's response to COVID, or whether it's response to hurricanes, or whether it's response to the opiate epidemic, we have no public health system. And so, so we are at substantial risk for whatever hazards confront us. And let me just say, for no other reason except that it's heartfelt, we need to thank people like Senator Gibson and others in the legislature who have had to endure these assaults on our behalf. And I know it must be incredibly difficult. I couldn't do it. I mean, I live in a state of constant, low-level, sometimes surging anger and frustration and sadness. And so, Senator Gibson, thanks to you and your colleagues for at least providing some sense of normalcy in the whether this is how totalitarian regimes start. This is exactly how they start, and nobody should be surprised if this doesn't continue. And the University of Florida supporting Ladapo. He's a University of Florida faculty member. It happened one day he was in Los Angeles. The next day he's a faculty member at the University of Florida, and the next day, literally the next day, he's Surgeon General. And so people should be focusing their ire as well on institutions that are facilitating this totalitarian takeover of our politics. And I don't say that with any degree of what's the word? I don't even know what the word is. I think this is how totalitarian regimes start.
And Jeff, we've had many conversations about, in a usual structure, the way it works, at least here in Duval County, is if a hurricane was threatening, I'll even go back to the AIDS epidemic. When it started, I don't recall, maybe I just don't recall, I don't recall politics taking over and making decisions about health and medical issues related to combating the HIV/AIDS epidemic or SARS or anything else. So why do you think this particular, and I know this is different, this isn't a pandemic and that wasn't, but again, it still threatened so many lives. Why do you think, and this is for any of you, why do you think that politicians would not let scientists and the medical community take charge of this fully?
It's politicians. Not all politicians are good people. I agree with Jeff. I commend Senator Gibson with her efforts. We talk frequently. She keeps me abreast of what's going on in terms of her efforts and her colleagues' efforts in terms of trying to help protect the citizens of Florida. But we have those individuals, and some of them are not all, it's not just Republicans, but we have many of them that have succumbed to the finances, to the what do you call those guys? The lobbyists, the monies associated with, and I can't say it any worse than any better, just being bribed to go along for their own self-interest as far as being financially rewarded when it comes down to making some decisions that may help determine whether you or me and anybody else on this panel live or die, without even knowing, not having any scientific background. And to bring on a Surgeon General that, I mean, and you know, the things that he's saying in terms of his thought processes of what's going on with this this pandemic is something that he should be deboarded, decertified as being a boarded internal medicine surgeon, whatever the heck he's boarded in, other than idiocracy. He needs to go, never be certified. And I applaud Audrey for her attempt. Go ahead.
What'd you say, Senator?
You will note you haven't heard a peep out of him since the debacle in the senator's office. His name hasn't been mentioned. His voice has not been heard. And there's that. And when the news broke about how he ultimately ended up in the faculty and all the players that were involved in moving him from UCLA to a faculty member to a Surgeon General, what, in a day, I think it might have been, not one sound.
It's a lot of illegalities, I think, took place with that.
I think one of the things that I'd like for us to talk about, because I certainly don't want us to leave the show. Yeah, I don't want us to leave the show without something. And Jeff said it a little while ago. Sadly, the people who are impacted by this the most, or in many cases, are Black and brown people.
Yes.
And so the reality is, when it's time to vote, Senator, people need to learn how to educate themselves to choose the people who will fight for their rights. What advice would you give people to figure out, how do I find out who's the best candidate? And the best candidate might not look like you, might not come from your culture, but it's the best candidate who will fight for the rights that most of us believe in. Because the thing I think that we all have in common is we want good for our families. We want to protect ourselves and our families. And so how do people get involved in the whole process of choosing the right candidate?
The right candidate may not bring you fried chicken and watermelon, but go ahead, Senator.
I couldn't say that.
Nor would I, Jeff.
And let's throw in that perhaps the best candidate may come from your culture. And it might, absolutely. It may not come from, but they may also
because I'm a fan of Senator Audrey Gibson. You're absolutely right, Senator.
So I tell people to listen. I mean, we get all the literature and all that in the mail. And, many times, who are not really super engaged, even just listening, they don't tune in, right? And they wait till the last minute, and then, okay, well, what should we do? So this is what I tell people all the time: listen to what's being said, right? What their pointers are. For example, we have some candidates now in Jacksonville who say, "Oh, we're gonna improve those neighborhoods that have been neglected, or make sure they're included," but they don't have a plan. So I always tell people, when you listen to those 3 or 4 points that are being made, if the person doesn't have a plan, it's not going to happen. Because you can say you're going to improve the neighborhoods that have been left behind, whatever the heck that means. But what's your plan? How are you going to do it? And how are you going to do what some people have, they put their finger up and see which way the wind's blowing and say, "Oh, well, let's put a new swing set in the park." Oh, yay. That's not transformative, right? So you have to listen for the execution of what they're saying they're going to do. Because if you don't have a plan, you don't know what direction you're heading in, you have no record or background in bringing anything to fruition, how are you going to do it? How is it going to happen? And we shouldn't believe that it's going to happen if there's not, we're going to do this, this, and this. It's like giving the prescription doctors and telling a patient, okay, here's your prescription. They're going to put it on the bottle, but I need you to take this at 8, this at 10, this at midnight, and then you're going to start to feel better. No specificity, no getting better.
No plan. And I can't go by without saying that we're still accepting Florida funds for federal funds in Florida, even though we don't want to abide by federal guidelines. And the other thing, as it relates to Senator Gibson and what she says about people and their plans, are those people who, especially listening in our sheriff race. I know we have one of the candidates that says, when was asked, what are you going to do different than the previous sheriff did? And they say absolutely nothing. Then why do we need this? You might well vote for the same sheriff if you're not going to do anything different, so I digress.
Right.
Yeah, I'm gonna have to apologize because I'm gonna have to.
No, we're about ready to end, Jeff, because we promised you guys.
But I would like for you to say some final words, Jeff, before you log off, because this is a serious matter that we certainly haven't taken lightly tonight. And although we had some technical difficulties, we always like for our guests to leave with some parting words to our listeners.
Well, really, this is not about COVID. This is about future. Everything's on the line at this point in time. Our democracy is on the line. If anybody thinks that this is about just about this pandemic, they misunderstand. When disinformation and misinformation and partisan politics can get to the point where 60,000 Floridians die, most unnecessarily, then we are at a point in time where Stalin killed millions of people, Hitler killed millions of people, DeSantis is killing millions of people, or thousands or tens of thousands of people, and our democracy, our future is on the line here, and this is not just about a pandemic. I thought 5 years ago that our institutions, American institutions, were strong enough to withstand. I mean, clearly they're not strong enough to withstand the assaults and insults that have been perpetrated. And it gets down, and frankly, in this community, in the state, it gets down to if minorities vote. If Black people vote, we win. If they don't vote, then, we don't. And, we're at a point in time where minorities now, whether it's Black or brown or Hispanic, whatever, have a major influence. And, everything's at stake. Everything's at stake. And I'll tell you how terribly this has affected people. 2 years ago, Rogers Kane's hair and beard were black. Now look at it. But I didn't have any hair. For sure, I didn't have any hair.
And 2 years ago, I wasn't working, right? I retired. And quite frankly, COVID brought me out of retirement. And so this is serious, folks. And thank you, Jeff, for those parting words, because you're right. It's not just about the pandemic, as some of our listeners have also noted, that it's more about, one even said, the economics of racism. It's about power. Some have even alluded to it's about the browning of America. The fact that America is changing and people are feeling threatened by it. But I recall a meeting that I was in a few months ago that said we should be ashamed of ourselves. We should embrace our differences, learn from one another's cultures, and figure out how we can make this country great, not greater, great. Since that's what people want to say, make America great. I say make it, and to embrace the cultures that for years we've allowed different people from other countries to come over and become citizens of our country. But Senator, what are your parting words to our listeners?
Well, it's listen for disingenuine talk, which is what this whole special session about, because the party of less government banded government in one of the bills, because they want their own agency for which we already, and they want to spend more money for something that we already don't have to pay for to keep people safe. The party of the business community just threw a big brick at the business community, because now those businesses who want to protect their workers and their patrons, if they have patrons, now don't have the ability to do that. And so people should pay close attention, and don't forget, wherever you need to write it down, is here's what happened. I lost several of my friends, or I lost several of my family members unnecessarily, because we had a governor and other legislators who refused to keep us safe. And so don't fall for the okie doke that if you decide you leave to your job, that you can go collect unemployment. If you decide you have to leave, or if you get laid off, not going to take vaccine, don't look for the unemployment to help you. Not. And I asked the question this: are we going to raise the unemployment rate? And the answer is, well, we're not dealing with that. Well, listen, all of us should be vigilant in staying safe. Wear your mask if that's what you want to do. Send your children to school with their mask if that's what you want to do, and dare them to make your child or you take your mask off, and then see
Yep.
how this legislation works.
Thank you, and that's powerful. Really call people out, and I like the people need to pay a close attention. We don't need to just stand by and wait for things to happen or see, and with the attitude, oh, they're going to do what they want to do. No, your vote really matters. So why do you think people come to your churches, your social gatherings? Because they know that your one vote does make a difference, and collectively all of our votes do matter. Dr. Kane, what are your final thoughts for our guest tonight?
I will say, even though Jeff is off, I really appreciate him joining us on our show live. He's had some very thoughtful, passionate, and thoughtful input into the program. I'd like to thank Senator Gibson and her passion that she demonstrates on a regular basis. I always kid her about, when do you get rest? When do you sleep? And she seems to be, she appears to be tireless. I won't put her on the spot and ask her what she's going to do next. I'll wait for that for a future show. Hopefully we can have her back and she let us know what she's doing
wink,
next.
Wink,
wink, wink. But one of the things I will say is that it reminds me of I'm old enough, and I think everybody's on this line right now, old enough to remember the Beverly Hillbillies. And in Beverly Hillbillies, you had Granny, the character that was kind of funny at one point in time. But one of the things Granny always said was, Jeb, the South shall rise again. And that's what we're trying. That's what I think we're seeing right now. We're seeing attempts at the South trying to rise again and reinstitute slavery, or the behavior, as Jeff said, totalitarianism, allowing that to take place to the point that it's a cult. And I understand that black and brown are not the only ones being affected. It's black and brown and the poor. And
Right.
at the expense of, as in Bonanza used to say, the townspeople at the expense of the ranchers are being screwed on this one. So, and I've never been a man that doesn't mind telling it like it is, whatever the consequences may be. And I hope my colleagues also take heed that they will help join the fight. I was wanting to retire, but they need to help join this fight and prevent our children from growing up, going back in this world of totalitarianism or racist slavery mentality.
Thank you, Dr. Kane. That was a mouthful. And I think my final thoughts for tonight's show is, as the senator said, pay attention, educate yourself on what's going on around you. We try on this podcast to bring what we call the experts who are out there fighting for us, who are knowledgeable in the subject areas that we bring to you each Tuesday night. We obviously need to continue the discussion about COVID, especially because there is a new variant, right, Dr. Kane?
Absolutely.
And so people need to understand that until we reach herd immunity, and it is possible to reach herd immunity. However, until we reach herd immunity, we are going to get one variant after another. Thank you all for listening to us tonight. Thank you to those who posted questions. Thank you to those who shared, our link on your social media platforms. Please email us if you have any show ideas, as we are here every Tuesday night. And remember, pause for the truth every Tuesday so that we can tell you what's really going on. Good night, everybody.